I work as a chronic disease manager for the Veterans Hospital in Dallas, Texas. It's my pleasure and privilege to talk to you about diabetes today. I hope the slide is up there. Slide number 2. Diabetes, the definition and types. Diabetes is characterized by the abnormal metabolism of carbohydrates, proteins, and fats, and it leads to a high blood sugar state or hyperglycemic state. There are mainly 3 types of diabetes: type 1, type 2, and gestational. Type 1 is used to be found in the kids in the olden times, but it's very common in the adults too. If you have a type 1 diabetes, you cannot survive without the insulin shots. If you have type 2 diabetes, you could manage your diabetes just with oral medications, or you may need the insulin shots to begin with or sometimes later during your life. The third type is gestational diabetes. It is called gestational because it happens during the pregnancy. Once you've been diagnosed with gestational diabetes, there is a high possibility that you might get diabetic in the next 10 years. And there are some other kinds due to some defects in the pancreas. The next slide talks about diagnosing diabetes and pre-diabetes. Have you all heard about the term hemoglobin A1C? Has anybody heard the term? If you are a diabetic, please be familiar with that terminology. Hemoglobin A1C is a 3 months average of your blood sugar. The normal hemoglobin A1C is 4 to 5.7. If you have 5.8 to 6.4, that means you're pre-diabetes, meaning you might get diabetes in the future. And for anybody that has diabetes, the hemoglobin A1C should be less than 7. That is what the goal for anybody that's already diabetic. But based on the new research, if you are 65 years of age or older, it's okay to be between 7.5 and 8 in order to prevent the low blood sugar events. The next slide is about the signs and symptoms of diabetes. Type 1 diabetes: frequent urination, unusual thirst, extreme hunger, unusual weight loss, extreme fatigue, and irritability. Type 2 diabetes: any of the type 1 symptoms that we just mentioned. Along with that, frequent infections, blurred vision, cuts and bruises that is slow to heal, tingling, numbness in the hands and feet, recurring skin, gum, or bladder infections. I have patients that's complaining whenever they were diagnosed with diabetes, they have had so many abscesses or boils that was never healing. That's how they found out that they're diabetic. The next slide is about risk factors for developing type 2 diabetes. The first one, impaired glucose tolerance and impaired fasting glucose. That means when you wake up in the morning, if your blood sugar is between 100 and 125, please don't ignore it. That could be a warning sign that you might be diabetic in the future, because that happens. That numbers happen when you have pre-diabetes. If your age is more than 45, that's another risk factor. If you have a family history of diabetes, like your immediate family member, your parents or your brother, sister, anybody has diabetes, that could be a warning sign that you could be diabetic in the future. If you have body mass index of more than 25, that means if you are overweight, that's another risk factor. Lack of exercise is another factor. Lack of good cholesterol, which is called high density lipids, and the high triglycerides, which is a bad cholesterol, is another risk factor. Then certain ethnicities like American and Alaska Natives and also the Asians are at very high risk. According to International Diabetes Federation, in 2009, India was #1 with the highest number of diabetes patients. The next slide, I just put that slide in there just to let you know that the commonly affected age group, the mostly affected age group with diabetes is 45 to 64. So if you're in that age group, just be aware for the warning signs. Then the next slide talks about prevention of diabetes. Did you all know that the diabetes could be preventable? It is preventable. You can prevent diabetes by healthy eating, regular exercise, and medications. Most of the stuff that I wanted to talk about this is being covered by Dr. Vijay already, but let me just highlight on some few points. Healthy eating. The quantity of the meal really matters. That's what he was talking about, the portion control. You need the carbohydrates, protein, and the fats, and the vegetables in each of your meal. You need 5 to 6 servings of vegetables and fruits together in your daily meals. And if you're diabetic, just instead of the fruits, replace it with some vegetables. We'll talk about the carbohydrates amount in the next slides. You can have the protein, which is your meat, your fish, poultry, or eggs. Just like he said, it should be the size of your palm and the deck of a card thickness. Whatever you eat more than that is going to store as fat. So for men it goes to the belly mostly, and for the women it goes to the hips. And the next one is the regular, and the fat. Fat comes automatically, you don't have to add the fat. Regular exercise. Study research shows that regular exercise, at least 30 minutes a day, which is 150 minutes per week, is really good, and you can prevent most of the chronic diseases if you do that. And also clinical trials show that losing 5 to 7% of your body weight, that means 10 to 14 pounds if you have 200 pounds, and getting at least 2.5 hours of moderate physical activity each week reduces the risk of type 2 diabetes by nearly 60% in those at high risk for the disease. Then the medications. In the olden days, people didn't want to take the medications, but the new research shows that if you have pre-diabetes or if you have high risk for developing diabetes, it is better to start with the metformin, which is the first line of drug for diabetes. It is okay to start with that drug even if you have only pre-diabetes, and that can either prevent your type 2 diabetes in the future or it can delay your diabetes. The next slide talks about self-management of diabetes, which means if you have already been diagnosed with diabetes, what you can do. 60% of the treatment effect comes from lifestyle changes, and only 40% comes with the medications. Let's talk about things that you need to watch to keep it under control once you are diagnosed with diabetes. First of all is lifestyle modification, and the most important thing is healthy eating. Read the food labels. We will have another slide on that for me to explain on that. Then make wise choices at the restaurants. When you go to the restaurant, you always have the liberty to ask them what is the carbohydrate content in the food that you're eating. Then smart snacking. Fresh vegetable sliced with salsa, lean turkey on whole grain crackers, celery sticks filled with peanut butter. I have several patients that's eating celery sticks with peanut butter. That's called smart snacking. Instead of choosing a piece of cake or a piece of pie, use something like smart snacks that has 1 ounce of protein along with the carbohydrates. Then monitoring total carbohydrates is the key point. We have a common misunderstanding that diabetics need to be on low carbohydrate diet, which is wrong, because the calories primarily comes from the carbohydrates. So even if you're diabetic, you need energy just like anybody else. So you need to be eating 45 to 60 grams of carbohydrate per meal. I know it's not very easy to remember that amount, but how do you know if it is 45 to 60? Anything like a small, like a piece of bread, like a small piece of waffle, a piece of pancake, or a small piece like a tennis ball sized piece of fruit, all those are 15 grams. And if it is the vegetables like corns, the potatoes and beans and peas, all those are carbohydrates. So when you, just because they are vegetables, just be watchful because they are starchy vegetables. So half cup of any of those is like 15 grams, just to remember. So 45 grams to 60 grams of carbs per meal for a medium to tall man, and 30 grams to 45 grams per meal for a medium to tall woman. So for me, I would say like 30 grams of carbohydrates per meal is what I'm supposed to eat. Whatever I eat extra, like carbohydrates or fat or protein, more than what I'm supposed to, that goes as stored as fat in my body. And then the next one is 25 to 30 grams of fiber per day is good for you. Moderate use of non-nutritive sweeteners is acceptable. People have this common question, can we use stevia, Truvia, all the Splenda, is that good for you? It is not really good for you if you take it in like 10 packets for 1 cup of coffee. It's not definitely good for you because that has sugar, alcohol in it. It has the same effect as you take 1 tablespoon of real sugar. So as long as you use it in moderate amounts, like 1 packet or less than 1 packet of Splenda for 1 cup of coffee, you should be fine. And the low carbohydrate meals is not recommended for diabetes. We already said that. And daily vitamin D supplementation, that's been a new thing out there. Vitamin D has an active role in regulating pancreatic beta cells, which make insulin. Other research has shown that supplementing with vitamin D and calcium slows the progression to type 2 diabetes. So it's good if you can remind your primary care physician to be on that, or it's something that you can buy over the counter. Slide number 9, reading the label. When you buy food items from the store, make sure you read the labels. Always look for the serving size. I hope the slide is up there with the label. Always you have to look for the serving size on the top, because that is the things that are talking about that whatever is written underneath. When you see total carbohydrates like 50 grams, that doesn't mean it's talking about the entire package. It's talking about that particular serving size written on the top. Like if you have a cereal box, maybe it will say half a cup. So the total carbohydrate may be like 23 grams. That means it's only talking about the half cup of cereal, not the entire box. So then he already covered, Dr. Vijay has already told about the fats and everything, like trans fat is not good for you, and monounsaturated fats and polyunsaturated fats are really good for you. And also it'll be good if you can watch the sodium. It's not really for the diabetes, but for the healthy eating. According to American Heart Association, in 24 hours, the maximum sodium you can have is less than 2400 milligrams. So if you eat like a lot of bacon and hot dogs and sausages, I know it has a lot of sodium in one piece. So make sure in 24 hours you don't go over 2400 milligrams. Remember, wherever salt goes, water goes. So if you watch your sodium, you could even lose the water weight that you've been accumulating all this time. Next slide is a plate method. If you cannot remember at all this 45 and 60 and all those numbers, just remember this plate. That plate is, like half of the plate should be like vegetables. Whenever you take your plate to go eat, just remember half of your plate should be the vegetables and the other half you could divide, like half is protein and the other half is carbohydrates. So whatever you can fill in that little section of the plate is protein, your meat, your fish or poultry, and the other portion should be your carbohydrates like potatoes or corns or rice. And just to let you know, because we are Asians, we are Indians, we eat a lot of rice. The 1/3 of a small cup of rice is 15 grams. So 1/3 of a small cup is 15 grams. So one small cup is 45 grams. That means that's already the limit of the carbohydrates that you can eat in that meal. And that's for a tall girl or a medium man. So if you're a short one or a medium girl, you can have only like a 2/3 of, like less than 1 cup. So just imagine how much we are eating on a daily basis. Slide number 11, self-management of diabetes being active. We already talked about it in the previous slide, plus Dr. Vijay has talked about this. Just want to let you know again, like 150 minutes of cumulated moderate intensity aerobic physical activity per week is good, like brisk walking. If you cannot walk for like 30 minutes at a stretch, you can do like 3 10-minute walk, which has the same effect as you walk one time 30 minutes. A moderate weight loss of 5 to 10% weight, you can that's also reduce the risk of developing type 2 diabetes. The next slide talks about medications. That is the main section of diabetes. First one is oral medications. There are different types of medications for diabetes. The first line of drug is metformin. Your primary care physician will put you on the right one. But you need to know how to take the medications in terms of your food intake. Metformin is a drug that if you are diabetic, I'm sure you must be taking it. And if metformin you're taking, you need to make sure that you take it with the meals, because that can cause diarrhea and upset stomach and all that. There are some other medications like glyburide and glipizide. All those are the ones that you take 30 minutes before you eat a meal, usually the breakfast and the dinner. Because in 30 minutes it stimulates the pancreas to make more insulin, and now that insulin is in there, if you don't eat in that 30 minutes, you might get your blood sugars too low. And then the insulin. Let me list some important points to remember while you're on insulin. Always rotate the site when you give the shots, not on the muscle but on the fats. The insulin is supposed to be put into the fat, not on the muscle. That's why it's very important to give it on the belly. And when you give the insulin, you have to make sure that you move like 2 inches away from your navel and then rotate, that way the area gets enough time to heal before you stick in that same area. Then check for the expiry dates as once it's open, because based on different brands, the expiry date is different. Do not mix certain kinds of insulin. All these are some information that the doctors or the pharmacist should be telling you, or it might be written on the bottles. If you see any crystals or sediments in the vial, do not use it as it might not be effective anymore. If you go for any walking or exercise, make sure your blood sugar is at least 110 before you go for it. If it is less than that, you need to make sure to take a healthy snack before you go. When you go on Sundays to church, because we have seen that commonly in the churches that people pass out, they might have taken their insulins and then didn't eat and come to the church. And so if you are taking certain kind of insulins that you have to eat in 30 minutes, do not take the insulin when you go to church. If you are taking it, make sure you eat. And also it's true with some oral medications. Also, you could give the long-acting 24 hours insulin that you probably take once a day. You could give that one. Do not skip that insulin even if you're not eating, because that works over 24 hours. And also another thing is the people that take the insulin, you might have noticed that they gain the weight because the blood sugar is high in your blood, and once you take the insulin grab that extra sugar from your blood and take it to your cells. Now that the energy is available in your cells, if you don't utilize it by walking or do some kind of exercise, your cells are going to grow more. So that's how people gain weight when you're on insulin. And also, just want to let you know, the only medication that helps to manage the blood sugar in pregnancy is insulin. Low blood sugar levels are the most common and most serious side effect of insulin, and I'm sure you all might have experienced that if you are diabetic. Make sure you and those around you know how to identify the warning signs for low blood sugar and how to respond. You must test your blood sugar levels regularly while taking insulin. And there are some other drugs that it's been probably 2 or 3 years only that it's been out there called Byetta and Victoza. These are not insulins, but these are some shots. This is the best choice for type 2 diabetes people that are obese or overweight. Check with your primary care physician if you are a right candidate for that, because it acts by helping the pancreas secreting more insulin during the meals and suppress your appetite by delayed emptying of your stomach so you don't feel hungry anymore to eat more. And the only major side effect is nausea and sometimes vomiting too. But that is usually temporary. Check with your physician about that if you can beyond that. And the next one, I would like to tell you about some key concepts to know about diabetes. Pregnancy and diabetes. Women with diabetes, if you're planning to get pregnant, make sure your blood sugars are normal during at least the first 10 weeks. Manage your ABCs, which is A1C, blood pressure, and cholesterol level. Alcohol and cigarettes affect blood sugar control. I know doesn't have much important in this session, but if you take alcohol, excessive amounts of alcohol on a consistent basis can contribute to high blood sugars. Know the signs and symptoms of high and low blood sugars. Older people are more at risk of getting low sugar while on insulin. And also there's a wrong concept that because you're diabetic you need to have a snack all the time. That is a wrong statement. If your blood sugar is less than 110 at bedtime, then only you need a snack at bedtime. If your blood sugar is more than 110 or 120, you know your body, because some people may be okay with 110 or 100, but if you, based on your age and other complications, if your blood sugar average, if it is less than 110, then only you need an extra snack before you go to bed. No fruit after bedtime, after dinner time, because for some reason, because you're not active after your dinner time much. So if you take a fruit after dinner time, I have seen my patients have been coming with a very high sugar in the morning. And aspirin a day is good for you. It may reduce the risk of heart attacks or strokes by 20% or more. Men should start a daily aspirin at the age of 45, mainly to protect against heart attacks. Women should start it at 55, mainly to protect against stroke. So if you are that age group, check with your doctor. Unless you have any bleeding tendencies, you could be on a baby aspirin every day. And also make sure to be on, we call ACEs and ARBs, which is for kidney protection. If it is a good primary care physician, he will definitely put you on that, but you can check with your doctor, am I on a kidney protecting drug? And the next slide, always wear diabetes identification. Always carry some kind of carbohydrate snack, like some hard candies, and sugar tablets are available to buy in Walmart, Walgreens and all. Choose the right kind of cube sugar. Teach the family members how to respond to the symptoms of low sugar. And then the next slide, and eat or drink 10 to 15 grams of glucose. So if you have there's something called rule of 15. If your blood sugar is dropping, you have to eat like 15 grams of cube sugar at that time, which is like a half ounce, like a half cup of juice or half cup of regular soda or something. And check your blood sugar again in the next 15 minutes. If it hasn't come up more than 70, then only you drink the rest of the half, because if you drink all of them at the same time, it's going to make your blood sugar to be very high. And the next slide is about diabetes care schedule. These are the important things that you can be watchful, like every 3 months what all you need to do. Regular office visits, A1C test, blood pressure check, weight check, food check. Every 6 months A1C test if your blood sugar is stable, dental exam. Every year physical exam, comprehensive foot exam, blood cholesterol and blood fat test, kidney test, dilated eye exam and flu shot. And thank you for your time, and just want to let you know I have some booklets, really good booklets on the diabetes. It's there the very first doll for the good news. You can grab one and read it. And at this time, I would like to encourage all of you to be active, eat healthy, and take your medications as prescribed, and be ready for the kingdom of God. Thank you.